It is my pleasure to introduce to you Donna Thomson, who will talk to you about a caregiver perspective on communications in healthcare. Donna Thomson is a caregiver, author, and activist. At McMaster University, Donna is an award-winning instructor of the courses Caregiving Essentials and Family Engagement in Disability Health Research. Donna is the past vice chair of Kids Brain Health Network and is a leader and instructor in family engagement in health research. Donna also teaches families how to advocate for care at the Advocacy School and at huddle.com. For the Ontario Ministry of Health and Long-Term Care, Donna sat on the expert group on home and community care, the advisory committee for the white paper on aging, and on the working group on complex care for adults with developmental disabilities. So without further ado, Donna, please go ahead.
Thank you so much, Mark. It's really my pleasure to be here today. Today, we are going to be doing a bit of a deep dive into how caregivers perceive communications in healthcare settings. And, to talk a little bit about who are these caregivers, because as a group, we're not all the same. So I wanted to, let me just see about advancing my slides. There we go. So this is my family. That's me and my husband in the yellow shirt, our son, Nicholas, who's 32 now. And he has had a great deal of time spent in healthcare settings. He's had 98 hospitalizations, so we've been in and out of hospital all of his life. My mother is on the right. She died after living with dementia at the age of 96 in 2018, and my sister, who's standing beside Nicholas, and I cared for her in and out of the hospital. All of these other people are other members of our family, and also a couple of carers for Nicholas from his medical group home, who are really extensions of our family. So just as a sample of someone who uses the healthcare system a lot, this is everybody that you're talking to with every communication you make when we enter a healthcare setting. So Nicholas is what we call, at the hospital, in the vernacular of hospitals, he's a frequent flyer, and he lives in a medical group home with 24-hour one-to-one nursing. And I just use him as an example here because, I think if you're talking about the people who are most involved and getting the most frequent communication messages from healthcare institutions, that you might want to start with the people who get a lot of them, because there can be some lessons learned here, I think. So Nicholas, this photo was taken in the UK, where we lived for a period of time. This was Nick's first orthopedic surgery. It would not be his last. And more recently, he was in the ICU last year for another emergency and sepsis and so forth. So he really does spend a lot of time in the hospital. And in terms of the Canadian caregiving landscape, 1 in 4 Canadians is a caregiver and is caring for someone with dependency needs. I mean, that's over 8 million of us. And I'm sure probably everyone here listening today is a caregiver. But, I like to say to people when I'm talking about caregiving, that caregiving is really like cooking. There are some people would microwave a frozen dinner, and others would be cordon bleu chefs. There's the same range in the caregiving community of experience, knowledge, and interactions with healthcare systems. So I think one thing I'd like you to take away today is, who are you talking to? Are you talking to someone who, extending the analogy, is coming very infrequently, maybe for the first time to the hospital? Or are you talking to a frequent flyer? Because your communication and your messaging for both of those groups and for everybody in between is going to look very different. So one thing that can help ascertain who you're talking to in this community is just this little visual of the 5 phases of caregiver identity. So we're just looking at 4 today, but this is when, top left, you're beginning to give care to someone who has a new diagnosis or is undergoing a treatment, a procedure at the hospital, and is needing extra care at home, or because of aging. Slowly that caregiver role begins to subsume other parts of the caregiver's life. So, you might have to give up your volunteer work. You might have to give up your book club, sports, going to the gym, whatever. Caregiving and the activities of supporting another person's needs begin to really take over your life. So it's always really helpful to know, where does your audience sit? Who are you talking to? What do you want them to understand? And where do they fit? Because the caregiver is actually an extension of the patient. And caregivers, especially now during the pandemic, have suddenly been rebranded. We'll talk about that in a minute. But, I don't think we can underestimate the contribution of caregivers and the importance of talking to them. So 90% of total care is given by family caregivers, informal caregivers, could be neighbors in some cases as well, and friends. But that's $66.5 billion a year in unpaid labor. And you can see that this triad of the patient being in the middle, and these are the major sort of players in the patient life. So lots of times people, if they are coming to hospital, they will also be involved with home health care as well. So there are lots of clinical individuals in a patient's life who is someone who's frequently going to the hospital, so, like in my family. So during the pandemic, as I mentioned, family caregivers have been rebranded, as you probably know, from visitor to not just a visitor. We are essential family partners in care. And the Canadian Foundation for Healthcare Improvement has led this, but so has the National Institute on Aging. And the Ontario Caregiver Organization, for example, has begun an initiative to actually, have caregiver badges that people wear when they enter the hospital. So the CFHI Better Together Change Package is a guide to reintegrating families during the pandemic. And safely doing so. And there's a ton of information in this document, in their change package, which you can find on their website. A ton of information about communications and how to talk to essential family partners in care, how to direct them to safe practices in a COVID environment. So, top tip, tell a caregiver. If you want the patient and the patient's family to know something, tell the caregiver. Often, the caregiver, one of the key roles of a family caregiver is to share information within the family, and also share information to the home health care providers as well. So know that you've got a colleague in communications and family caregivers, because the caregiver is the bridge between the medical culture and the culture of home and family. And, because these are two very different cultures, there's such an opportunity for a missed communication or misunderstanding. So, and that miscommunication can often take place in transitions in care. So your entry points and your exit points. What do you want families to know? What do you need them to know? What do you need them to communicate to extended family? The do's and don'ts during a pandemic of being an essential partner in care. There are, or even if your hospital is communicating around IPAC procedures or safe practices, and you have a role in public health communications, you really want to look at where is that information going to be used? Where can accidents happen with respect to missed opportunities for communication? And I know that care transitions are when accidents happen. So I want to share with you a fantastic tool for communications in transitions, and it's called Next Step in Care. It's from the United Hospital Fund in New York State. But they have a whole section for family caregivers navigating transitions, but they also have a section for healthcare professionals, and it's really worth looking that one up. So the other thing that I wanted to share with you is something I've recently found. It's an online short course, which I did, on caregiver-centered care. And it's out of the University of Alberta. It's a video, there's lots of video scenarios, replaying scenarios the right way, the wrong way, of talking to caregivers. It's specific to clinicians talking to caregivers. But I think there's so much to learn here about how to talk to caregivers generally. So I would encourage you to do this short course. It is fantastic. I really love it. So their competency indicators for that short course are that you communicate in a manner that demonstrates respect, empathy, compassion towards the family caregiver, listen actively, and providing timely information. So getting the information to families when they need it and in ways they will understand. And communications can often support coordinated care by providing consistent documentation information amongst providers and family caregivers. So yeah, I added that last little bit. That's my thing about recognizing family caregivers as essential partners in the circle of care. So often, people will have a meeting and make major decisions about what's happening to our son and our family, and they forget to tell us. So, and how do you communicate with your patients and caregivers? And I'm saying patients and caregivers because they really are one and the same. In the committee for home and community care that I served on, we said the patient is the family. And I think that's true in hospital settings as well. So you can see this sign. My image is a bit blurry, but it says aggressive behavior or language will not be tolerated. And this is an image from a hospital. So I don't, I think that kind of communication is just not helpful for people who are very worried and under stress and not feeling well, and which is all exacerbated by the pandemic, of course. So I would say make kindness the norm. Is this message kind? Is this message projecting an understanding of the patient and family experience? And that's really it. I would love to take some questions now. Thank you so much.
Thank you so much, Donna, for your presentation. It's phenomenal. And we have, right out of the gate, we have Bill, he didn't leave necessarily a question, but he did make a comment. He said he completely agrees with you. And we have had tremendous success with our designated care partner visitor program, which we launched as a direct result of the pandemic. And Bill, if you're comfortable, would you be able to get on the microphone right now and maybe talk more about that program?
Yeah, thank you. Thank you for the opportunity. It's obviously a program that developed as a result of the pandemic. And we, just for context, we are a post-acute care hospital. So our length of stay is quite different, obviously, than the acute care system. We have nearly 300 beds, and we specialize in restorative care. So we have over 100 complex medical care beds, 20 palliative care. We have 90 rehab beds. So with length of stay being as long as it is, when we imposed the restrictions for visitation at the onset of the pandemic, we immediately experienced some of the fallout associated with that. The impact was clearly on patients, on family members as well. The isolation began to take a toll immediately. And our staff truly relies on the ability to work with family members as essential caregivers. And so a tribute to our clinical folks who developed the curriculum, the training requirements, and the program overall. And I don't recall when, but it was early on in the pandemic that we rolled it out, and it's been met with tremendous success. We haven't had any concerns or incidents around risk to health, risk to patients or staff. In fact, we were able to, by the end of August, we had a designated care partner for every one of our inpatient individuals. And just before, unfortunately, we've experienced an outbreak here on our campus 2 weeks ago. So just before the outbreak began, we were looking at a second DCP for every patient. We are going to resume that, but I wanted to share that, Donna, because it's really in line with what you've been, advocating this morning to every one of us here on the call.
Thank you so much for sharing that. That is I'm going to tell my friend Julie Drury, who is the patient and family lead at CFHI, who they have really, I'm sure you know, with their Better Together campaign and their change package, have taken a huge lead on this. And it's just inspiring to me to hear you, because I think that there are some permanent changes that are going to stay with us post-pandemic in terms of the broader relationships between providers and family essential caregivers. This idea that patients need their families, and if we're separated, patient outcomes are not good, and staff is experiencing moral distress, trying to be proxy family. It's all together. I think we have lots of evidence now that shows the real benefits of the family caregiver in healthcare settings.
Yeah, thank you as well. And thank you for those resources. Looking forward to looking at the caregiver-centered care program that you identified in the next steps in care as well, the comms tool. Thank you.
You're welcome.
Very nice. Thank you, Bill. And thank you, Donna, for that great answer. We have another question, which comes from Steve. Steve, did you want to get on the mic and ask your question?
Sure. Hi, Donna. Thank you very much for an excellent presentation. I'm Director of Communications at Healthcare Can, which is a national organization representing hospitals and healthcare research institutes. And you mentioned the phrase frequent flyer. And I mean, there's so much, which you know more than probably most of us, even that there's so much medical shorthand that gets used, and I'm just wondering if frequent flyer has a negative connotation in your mind a little bit.
Yes, it does.
Okay.
But I know that everybody knows what it is. So
That's kind of how it ends up, right? Is everybody sort of
Yeah.
understands it, and so then it becomes part of the nomenclature that goes forward. And
Sure.
bed
Yeah.
blocker.
Oh yeah, that's even worse, really. But I do know people who have a family member who is very medically complex, and they take great exception to the words frequent flyer. Personally, I don't think it's that bad. It's a shorthand. It's a shortcut to, and everybody, like you say, knows what it is. But I used to use the words lifer. We were a lifer in the hospital. And through my son's youth, particularly, he was in the hospital more than he was home. So, and you know, and it was, when I think back to those days, I knew everybody in the hospital. I knew the parking attendant. I knew all the ladies in the cafeteria. Every one of them every day would say, "How's your son doing?" And many of them would know him by name. So I think that, you know, we have that range of interaction, range of experience with healthcare settings. And so I, in terms of talking to me versus somebody, what I would have needed on my very first emergency room visit to a children's hospital when he was a newborn, I needed very different communications at various stages of my life. But at all stages, I needed reassurance and information. So let's just talk about the emergency room for 1 minute. You know, I think in terms of the communications in emergency rooms, it's very poor, I would say. I think, you know, you're told to go sit down and wait, but you're not given any instructions about what to do if the person you're with condition changes. I think I call it the cognitive lifeboat. The more information that patients and their families have about this is what you do if this is what you do if that, then there's a roadmap for the next 2 hours. And the caregiver responsibility is made clear. Tell us if this. And so, you know, you can see that is put up against don't shout, you know, aggressive behavior won't be tolerated. I think that people need information, and I tell this to home care providers. Give me some information about what to do between calling 911 and doing nothing. I need guidance in the probable events in the environment in the next couple of hours. Like, tell me what to do, what to look for. So that's my feedback on the emergency room. But yes, I think that transitions in care are also very important too.
Awesome. Thank you so much, Donna, and thank you, Stephen, for that great question. Next question, we have Stephanie Woodard. Stephanie, would you like to come on the mic and ask your question?
Sure. Thank you very much. Donna, this is great, really helpful. I'm just going to come at things from a little different angle. So I am from the Ottawa Regional Cancer Foundation, and we provide coaching support to caregivers. So their loved one is facing cancer. And a big part of the work we do is as we communicate to these individuals, you know, getting them to pay some attention to their health and their self-care. And it's such a challenge because whether it's the guilt of, no, I have to be with this person all the time, especially in the situation of cancer, if it's, you know, palliative, you know, there isn't much time left. So how do they balance that time? So I'm just curious if you had any thoughts on how you would want that to be communicated to you, or how would that discussion, you know, be brought forward, and maybe what kinds of things would be helpful for you to hear?
Well, self-care is a huge issue in the caregiving community, particularly in circumstances like you've described, where there's a need for hypervigilance And it's very difficult to get a mental break from worries about life and death, and the alleviating suffering is entirely on your shoulders as a caregiver. So what I say, I will offer two things here, because I could talk all day about self-care. But I think one thing is that it's important to remember that there are two people in a caregiving relationship who need care. And one of those two people is the caregiver. So how does that look? I mean, there's so much stuff in the mainstream about, oh, go have a bubble bath, or if you're exhausted, it's your fault. You know, you're not doing self-care properly. And this is ridiculous in the context of cancer. But I would say, I think it's possible to make 2 cups of tea. Instead of saying, here's a cup of tea, I'll have mine later. You know, I think that it is possible to begin to shift your thinking, that you need to give 2 people care, and at the same time. And often we forget that the people we are looking after care for us too, and to open up opportunities for them to give care as well. My mother, practically on her deathbed, said, you know, oh, my baby, she always called me her baby. I'm 65. And, you know, she'd say, come over here, I want to give you a massage. I always, you know, a hug is a form of care from the people we love. So, you know, I think if we shift our thinking to receiving that care, that can be quite helpful.
Thank you. That's really well put. Very brilliant. Appreciate that.
Thank you so much, Donna, again, and thank you, Stephanie. It looks like we have plenty of time actually for more questions. Oh, we have a comment actually from John. John, you would like to speak about your experience?
Yes, I used to work at Kingston General Hospital many moons ago, and when they started up the Patient Family Advisory Council, they came up with a brilliant, what I thought, system, and it would have to be done a little bit differently now in the world of COVID. But on the very first day of school, if you can imagine a room full of nervous medical students, and then standing up at the front are a bunch of professors, doctors, many in their white coats, and the room goes silent because no one is saying anything. And out walks, and I'll just make up a name, Doris Smith, and she has a cane, and she stands up at the front and she says, I want it known that I am a patient here, and I am the reason why you all are here. And that's not necessarily about the caregiver. That was very powerful. But can you imagine how much more powerful it would have been if then the next person walks out and says, hi, I'm Doris's husband, and I am also the reason why you are here, because we work together. And I wonder how powerful that next step would have been on the imprinting of young medical workers.
Yes, well, you know, I've always, first of all, I love the Kingston General Hospital is a leader in this area and has done fantastic work. And I think, you know, your message that patient stories, we know patient stories are very, very important to informing the way healthcare is delivered institutionally. But I don't think we've always appreciated the fact that caregiver stories are really important too. So it's good to try to collect them. And if you embrace this idea, I think it's a really even better idea, or as good an idea, to use your patient family advisory groups to co-create communication strategies that are going to reach everybody in the family and everybody in the circle of care. And so if you're crafting a communication strategy, work with your PFAC, with your advisory committee, because those people are experts in receiving communications and taking in messaging, and they are as invested in successful communications as everybody else is. But I think what you're getting at is that, often medical students, doctors, clinicians get into a mindset of the workplace that is really about serving the needs of the institution. And in healthcare, I think that patients and families have a major role to play in bringing people back to a place of kindness and compassion. And at the end of the day, people are sick and suffering if they're there. And the response that we need is our natural human response to that fact. But it's often difficult to maintain that level of compassion and communications when the institutional needs are always competing.
Perfect. Thank you, Donna. And thank you, John, for sharing that.
Thank
We
you.
still have some time for questions. So if anyone has more questions, please feel free to put it in the chat. But in the meantime, building on what you've actually said already, Donna, and your presentation on bringing that kindness and compassion back for us as communicators, what exactly, I guess, how can family caregivers be identified and supported through communication strategies? What are some of the strategies that you would recommend?
Yeah, well, the first basic thing I think in that question is how do you identify a family caregiver? And I'm speaking right now in the context of COVID. Of course, patients have to identify an essential family caregiver, but I'm post-COVID, in normal times, caregivers tend not to identify as such. Many caregivers do not use that word to describe their role in the family. That's a word that can feel very uncomfortable to use when you think of I'm a caregiver to my child, I'm a caregiver to my husband that I've been married to for 43 years. We don't think about our closest relationships in this way that assigns a different role to us. So I would say that if you're trying to identify caregivers, don't ask people if they're a caregiver. Ask them what they do on a daily basis to support the needs, the healthcare needs of the patient. And then you'll be able to tell. And I think once you've identified the caregiver, you can begin to funnel information. I just wanted to mention one more thing too, that might be another very helpful tool in the context of self-care. And it's something that came out of McMaster University CanChild, which is a section of McMaster that does disability. And it's called the F words of childhood disability, but really now they're rebranding it as the F words for living. And the F words are function, fun, family, fitness, I can't remember the other ones. There's two more. And there's actually a template that you can fill out. What are you going to do today or this week or this month for these, under these domains? And these domains are actually from the WHO. So this is the classification of function. And if everybody in the family fills out one of these templates, then you can put them all on the table, even in where there's a disease progression. So this is what I'd like to do for fun, given the givens of my disease. As a caregiver, this is what I would like to do with family, given the realities of COVID, for example. So this is a very flexible tool, helping people, even in healthcare, even in inpatients or outpatients, determine how they can live a good life with health care challenges.